Opioid misuse and overdose cases in the United States are rising at alarming rates, and there is an urgent need for prevention, treatment, and recovery policies that can reduce the opioid epidemic.
And we as emergency physicians, we see firsthand every day the problems of prescription misuse.
ACEP President Dr. Kaplan, representing thousands of emergency physicians on the front lines of this crisis, was one of a handful of distinguished medical experts, lawmakers, and stakeholders on Capitol Hill that joined the coalition to stop opioid overdose.
I don't want to tell another parent, a child, or sibling that their loved one has been lost to opioid overdose.
The event was moderated by nationally known television personality Dr. Mehmet Oz, a New York cardiologist and host of The Dr. Oz Show.
We now, I think, are on the threshold of a national unified approach to treating addiction, which takes it out of the place that I mentioned earlier, where it was a criminal event. We thought of addiction as a moral shortcoming, a moral failing, and now recognizing that it's actually good policy and it's good politics to help folks who desperately need help get past those issues.
The goal of this coalition is to ensure that Congress passes meaningful legislation this year to address the opioid epidemic. Several lawmakers from states hard hit by this crisis were on hand to talk about what needs to be done.
I'm as guilty as any political person over the last 20 years. 20 years ago, I looked at this as a crime. You fool with drugs, you're committing a crime. We're going to put you in jail. We've spent $450 billion. $450 billion in the last decade, incarcerated. What was the outcome? Nothing.
You know, in my state, and I think across the country now, more people are dying from overdoses than car accidents. That means whether they're doing really great with car accidents or really bad with drugs or a little bit of both. So I have a bill that's a bipartisan bill with Ed Markey that would increase the number of patients who can get replacement treatment, the Suboxone, the oral treatment or sublingual treatment. And I think it's a really good common sense thing.
You cannot convince me that this country cannot marshal the resources necessary to put a real dent into this. You know, we have the families are out there, they're engaged, they're active, they're lobbying, they're figuring out both at the state and federal level what they need to do to push the programs that need to be pushed and the money that needs to get down to the ground.
And we're just trying to get as strong a bill as possible is our goal. We think it's really important to get this done, having spent last night with people whose kids who are around the Capitol this week were killed by opioid overdoses. It hits home why this is so important.
Dr. Kaplan made it clear to lawmakers that this is not a one-size-fits-all issue, that every patient is different, and there are many patients who legitimately seek treatment for pain.
We really urge our lawmakers to balance the legitimate need of patients with pain with the need to end the misuse of prescription medications.
For more information on opioids and legislation ACEP supports, please go to our website at www.acep.org.